This is the second part of types of data and indicators. This presentation was developed by Thien Hancock. Slide 16. What is a good health indicator? An indicator should be timely, periodic, reliable and consistent, valid, specific and sensitive, representative, feasible and affordable, relevant and useful for decision making. Slide 17. Timeliness is the period between data collection and its availability to a higher level, or its publication. Slide 18. Periodicity is the frequency with which an indicator is measured. Slide 19. Reliability and consistency are synonyms. If the data was immediately collected a second time, would the analysis yield the same results? It is reliability. The reliability may be internal or between datasets. Slide 20. Validity is credibility. You should answer, is the data providing you a correct result? Slide 21. There are 4 scenarios for validity and reliability. The first is reliable but not valid. If you repeat measurement, you get the same results. It is not valid because you don't get a correct result. The second on the top indicator is neither reliable or valid. The first on the bottom. The indicator is valid but not reliable. The second on the bottom, your measurement is valid and reliable. Slide 22. Validity is composed by specificity and sensitivity. Specificity is the ability to correctly identify those who do not have the health indicator, disease/risk factor. Excellent specificity means a low rate of false positives, therefore a positive result is likely a true positive. But specificity doesn't tell you anything about the validity of a negative result. Sensitivity is the ability to correctly identify those who have the health indicator, disease/risk factor. Excellent sensitivity means a low rate of false negatives, therefore a negative result is likely a true negative, but sensitivity doesn't tell you anything about the validity of a positive. Slide 23. Representativeness is the extent to which data adequately represent the population and relevant subpopulations. Slide 24. Feasibility. Can the data be easily collected? Is there a financial cost or other challenges that would make data capture difficult? Slide 25. Relevance. If the indicator provides appropriate and applicable information to meet the purpose and objectives of the system. Slide 26. How valid is the data collected? Does data address your surveillance purpose and objectives? What case definitions are used? What is the sensitivity and specificity of these? Specific examples: laboratory-based surveillance, syndromic surveillance. Slide 27. Can you fill in this box on laboratory-based surveillance? Which are the purpose and objective? What are case definitions? Which is the sensitivity or specificity? Does this fit with the purpose and objectives of the system? Slide 28. The purpose and objective of laboratory-based surveillance is to aid in the prevention and control of infectious diseases based on laboratory results. Case definitions are narrow, based on laboratory criteria. The system has low sensitivity and high specificity. This system is an important contributor to surveillance, but cannot be the only piece due to poor sensitivity. Slide 29. We are going to fill in for syndromic surveillance. Which are the purpose and objective? What are case definitions? Which is the sensitivity or specificity? Does this fit with the purpose and objectives of the system? Slide 30. Syndromic surveillance identifies potential outbreaks based on the clinical characteristics of patients seen in urgent care. Case definitions are broad. These does not require confirmation. The system has high sensitivity and low specificity. Syndromic surveillance has a high sensitivity to identify possible outbreaks for investigation. Slide 31. Core indicators make up the backbone of a country/jurisdiction's health information system. They are used regularly for planning, monitoring, and evaluation. Core indicators are linked to a broader national statistics strategy. For the best effectiveness, you will need a minimum set of indicators. Core indicators meet international technical standards. They are harmonized with key indicator and global initiatives, Millennium Development Goals (MGD), Global Fund to Fight AIDS, Tuberculosis and Malaria, GFIM, Global Alliance for Vaccines and Immunization, Gavi, President's Emergency Plan for AIDS Relief, PEPFAR. Slide 32. This is the first part of a list of examples of core indicators. Slide 33. More examples of core indicators. Slide 34. Other examples. Slide 35. If you need indicators from determinants of health, the sources of data will be census, vital statistics, population surveys, and individual records. Population surveys, individual and service records are data sources for health systems. Both inputs, outputs and outcomes. Census and resource records are useful for inputs and outputs. You can use census, vital statistics, population surveys, individual and service records for health status indicators.